managing the health of people across the continuum. I stole this blatantly from poor Beth Gray, and so I'm going to steal it again, Beth. I'm sorry. If you look at a population from the very highest level, you could generally slice it 3 different ways. You could say that there's a percentage of the patients who are very healthy, making great health choices, and you want to just help them stay healthy. Great. You have a large chunk of the population, and Dr. Nash spoke to this yesterday, a large chunk who have health risks. We might give them a diagnosis, but really they are having risky behaviors that are going to result in irreversible health conditions in the future unless we change that. We want to help those patients make better choices, be healthier, so they can shift into that healthy, making good choices population. And then you have this third group, fairly small percentage, but they already have irreversible health conditions. They have already been harmed by their health, by either their health choices or their genetics or their environment. And how do we not shift them, but how do we take better care of them so that their quality of life is improved? And by the way, coming back all the way back to the Intermountain Health's example, if their quality of life is improved, it also can help our bottom line. We can keep them out of the emergency department because they don't have emergency health conditions. We can keep them out of hospitalizations when possible for things that frankly, sometimes we can avoid, but sometimes we can. I'm gonna introduce, and you're gonna see a number of videos in just a second, about our strategy on how to address a population. Beth Gray, while certainly a big part of her work is in that unhealthy, already has an irreversible health conditions group, I see Beth Gray's success really sitting in how do we help engage our patients to make better choices before they become patients. And for the last 3 years, we've scratched our heads about that in this very forum, about how do you get to the patient and make them have better health choices. And God bless Beth, she has been passionate about taking this on. Additionally, that includes things that maybe some people are a little uncomfortable with today. Engaging people in value-based insurance design, where maybe the choices that they make might result in more out-of-pocket costs. So it actually helps them make better choices. You're also going to hear from Alejandro Necochea on care coordination. This sits squarely in our patients that you saw earlier. What was it? The 10 patients who accounted for 20% of the cost or something like that. It was the amazingly expensive patients. Some of those, you cannot bend that cost. They're end-stage renal disease, they have end-stage cancer, but some of them you can. And you're going to be hearing from Alejandro, Dr. Necochea on that. And then in post-acute care, we have heard more than once now already in this forum that 20 cents on the dollar is spent in post-acute care. We do not have within St. Luke's Health System until just recently a skilled nursing facility. We don't have a lot of control at this moment about how that money is going out the door, but we really should be paying attention to it. So with that, I'd like to go ahead and introduce Beth Gray.
Hello, my name is Beth Gray, and I'm the Director of Clinical Integration for Consumer Engagement and Wellness for Select Medical Network. I've been a nurse for 35 years and a nurse practitioner for 15 years, primarily in the areas of employee and occupational health. I work on the wellness side of the equation, where our goals are to keep healthy people healthy, prevent new disease, and support those with active disease by helping them learn better self-management. We developed St. Luke's Healthy You for St. Luke's employees, and now we're taking the same evidence-based approach to our population health strategy. The first step is to engage people, because we know that wellness is really a chronic condition that requires daily attention and healthy choices. The literature shows that health status is based 20% on biology or hereditary factors, 19% on environmental factors, only 10% on healthcare, and a whopping 51% on the lifestyle choices that we make. Daily choices around tobacco use, the food and portions we eat and drink, the amount of physical activity we engage in, and how we manage our stress, as well as more complex substance abuse issues, are key decisions that impact health. We need to engage people in our communities in every encounter to help them navigate these choices. Our approach is to support these efforts through key relationships with our communities to encourage health policy, with our providers by focusing on prevention and clinical integration, with employers and worksite programs, and with medical insurance plans through value-based insurance design. Here's an example. For tobacco cessation, we will continue to encourage no tobacco policy adoption. This year, we have implemented nicotine screening for St. Luke's employees in an effort to identify tobacco users and provide support to help them quit. Through our clinical integration efforts, we have adopted the American College of Chest Physicians' evidence-based approach to support people in their efforts to quit. This involves a layered approach of pharmacological aids, behavior modification, health coaching, and classes. We're exploring the use of social media to further support individual efforts. And for our providers, we have produced a video that outlines how to use this program and engage patients. We are in the process of embedding these tools into electronic health records. By partnering with payers, we can encourage the adoption of best practices and the best treatment plans. Thoughtful benefit plan design also encourages employee engagement and can offer the incentive of significant premium reductions when people choose to not use tobacco. And through employers, we're encouraging adoption of health policies in the workplace. By aligning these efforts, providers are equipped with strong support tools, policies encouraging non-tobacco use, and people have the resources to be successful. By using just these strategies, St. Luke's has been able to achieve an 80% quit rate for those employees who engage with us, compared with the national quit rate of 16% to 25%. Our overall system quit rate has been 28%. We're only just beginning, but together we can develop comprehensive strategy to engage consumers toward the triple aim of improved health for populations, better care for individuals, and over time, lower costs for everyone. Thank you.
Hello, my name is Alejandro Necochea. I'm an internal medicine physician in the Treasure Valley and the medical director for care management for Select Medical Network. I want to share with you some information about care coordination, part of our population health strategy that will help us focus resources for those patients in our accountable care population with the most complex needs. These patients represent a small portion of the total population, but the challenges they face, including high disease burden, behavioral health issues, weak social support structures, poor understanding of disease processes, and financial barriers are the most difficult to tackle. By matching patients' needs with appropriate resources, care coordination can help patients navigate these barriers to achieve better health. For example, a patient with progressive dementia who has no social support and lives alone in the community might require the help of a social worker to orchestrate a transition to an assisted living facility. A patient on a tight budget who has several chronic illnesses, sees several specialists, and takes several prescription medications from different sources might need the help of a pharmacist to reconcile his medications or figure out if the list could be simplified. By matching patient needs with resources, care coordination can also free up time for providers in clinics and hospitals, providers who would otherwise have tried to solve these problems themselves. The first steps in care coordination are to assess the needs of the population and to identify those patients with complex needs. For the past year, we have been working with White Cloud Analytics to refine our data-rich online population health tool, which is now being used for this task. Another important step is forming a network of caregivers who can perform care coordination tasks and support the care coordinators, including the pharmacists and social workers in the examples I gave earlier. Within our network, we are finding providers who are doing this work and who are eager to participate in our program. Once patients are identified, a key step is to engage their healthcare providers to ensure that care coordination is integrated into the care provided and making our care coordination part of the care delivery system. After a patient is enrolled, the care coordinators develop an individualized care plan for the patient based on his or her preferences and goals. This step is essential for patient and caregiver ownership in the process and to make sure we're on the right track with the right targets for the individual patient involved. Once a patient's goals are achieved, it's important to monitor the impact of care coordination, including utilization and patient satisfaction with the service, to make sure care coordination helps us move towards our accountable care goals. Care coordination is an exciting opportunity for our organization. This next generation of healthcare delivery will bring together providers across the continuum to help those patients who are most vulnerable and most in need of these vital support tools. Thank you for your time and attention today and for your work on behalf of our patients.
Hello, My name is Dr. Vic Kadian, and I'm the Medical Director for the Select Medical Network's Post-Acute Care Program in the Treasure Valley. My friend, Dr. Jonathan Myers, fulfills a similar role in the Magic Valley. My training is in physical medicine and rehabilitation, and I have practiced in the Treasure Valley for the last 9 years. In order to make sure we're all speaking the same language, I wanted to take a moment to make sure that we understood what we mean when we say post-acute care. We have defined post-acute care as the types of healthcare that are typically provided for patients once they leave a hospital setting. These are services that a patient may receive at a long-term acute care hospital, in an inpatient rehabilitation facility, a skilled nursing facility, various outpatient therapies in their home, home health, or hospice services. As we know by now, our healthcare costs are rising at an unsustainable pace, and this is especially true for the care we give our patients in the post-acute care setting. Over the last 2 decades, expenditures in this particular environment, that of post-acute care as we defined earlier, have risen 10 times faster than acute care hospital expenditures when measured against the diagnoses such as hip fracture, congestive heart failure, and heart attacks. As an example, when we look at the specifics of our medical service area representing the post-acute care our population receives, nearly 1 in every 5 total Medicare dollars are being spent in these post-acute care settings. In fact, this huge expenditure of resources is largely unmanaged, and we look closely at that care, it varies significantly when compared to other populations and other areas of the country. Select Medical Network's post-acute care program, which officially started in January, aims to address the needs of our population who are appropriate for post-acute care through an active management process and engagement of those facilities and stakeholders who are interested, like we are, in improving performance and the quality and value of our care. As we develop this program, we're working to standardize admissions guidelines and appropriateness criteria across our geography. We seek to decrease variability and waste by standardizing rehabilitation and medical care in coordination with those facilities and partners with which we have relationships and who share the same vision and desire for outcomes as the Select Medical Network and St. Luke's Health System. Our goals are to improve the coordination of patient care and outcomes and deliver clinically integrated, evidence-based, outcomes-driven care in post-acute care setting in a cost-effective manner. We have identified interested stakeholders and have encouraged their involvement and input as we manage these patients together in a measured and transparent way. Our efforts in this direction have had to do with standardizing clinical pathways, creating understandable guidelines and criteria that help steer our decisions, and developing clear outcome metrics for our partner facilities and care providers, and then to use what we learned to improve the quality and value of post-acute care. As we have seen earlier, our partners' willingness to measure ourselves and to improve our process is key to our success. Our metrics will help us create a scorecard that ensures transparency and that we can use to support our patients in helping them make informed decisions. It is a great example of shared decision-making and patient-centered care. Specifically, Select Medical Network's post-acute care program metrics will measure readmissions to an acute care hospital, ER visits, fall, average length of stay, and most importantly, how our patients do with our care by measuring things like safety, quality of care, and particularly their functional improvement. This key metric is the one I'm most excited about. It is our developing ability to measure our patients' change in function using a single tool across the continuum of care. The tool we have chosen is the Functional Independence Measure. It will allow us to see which post-acute care settings are most efficient for which patients for their functional recovery. Our program is just starting, but we can already see the value and potential that this area of focus promises. And we know that it's the right thing to do on behalf of our patients and their families. Thank you.